One of the biggest indicators of depression is hopelessness. This is when the mind begins to believe that the future will not improve, that things will always feel this way, or that nothing will make a meaningful difference. People often start losing interest in activities they once enjoyed. Things that used to bring pleasure or meaning suddenly feel flat or exhausting. Energy drops, motivation gets lower, and even small tasks can feel disproportionately difficult. Sleep patterns may change. Some people sleep much more than usual, while others struggle to sleep enough at all. Appetite can change as well, leading someone to eat much more or much less than normal without intending to. Depression also affects thinking. Concentration becomes harder, decisions feel more difficult to make, and the mind can begin focusing heavily on what is wrong or what could go badly while dismissing anything positive. Emotionally, people may feel persistent sadness, irritability, or a deep sense of emptiness. Feelings of worthlessness or excessive guilt can appear as well. Depression is a mental health condition that can be episodic or more chronic. When it appears in episodes, we typically call it major depressive disorder. When symptoms are long lasting, we call it persistent depressive disorder. There are also other diagnoses under the depression umbrella, such as adjustment disorder with depressed mood and postpartum depression. Depression affects both the mind and the body. Thinking often becomes more pessimistic, which is why cognitive reframing techniques can help people challenge distorted thinking patterns and see situations more realistically. At the same time, depression reduces energy and motivation. This is why behavioral activation is commonly used in treatment. This can be engaging in activities like exercise and social interaction that help push against the shutdown that depression creates. Depression usually develops from a combination of genetics and environment. Some people may have a biological vulnerability, while life stress, loss, trauma, isolation, or ongoing pressure can trigger or worsen symptoms. One of the hardest parts about depression is that it often convinces people their situation is hopeless. Fortunately, the evidence says otherwise. We have many evidence based ways to treat depression, and people can absolutely get better.